Today, Mr. Speaker, I'd like to update the House on the work we're doing to tackle variants of concern. In particular, variant B1617.2, which is the variant of concern first identified in India, so that we can protect the progress that we've worked so hard to achieve. There's now 2,323 confirmed cases of B1617.2 in the UK. 483 of these cases have been seen in Bolton and Blackburn with Darwin, where it's now the dominant strain. Cases there have doubled in the last week and are rising in all age groups. In Blackburn, hospitalisations are stable, with 8 people currently in hospital with COVID. And in Bolton, 19 people are now in hospital with coronavirus, the majority of whom are eligible for a vaccine but haven't yet had a vaccine. This shows the new variant is not tending to penetrate into older, vaccinated groups, and it underlines again the importance of getting the jab, especially, but not only, amongst the vulnerable age groups. Madam Deputy Speaker, Mr. Deputy Speaker, Mr. Deputy Speaker, in Bolton and Blackburn, we've taken the approach that worked in South London against the South African variant. We've surged in our rapid response team, 100 people so far, who this weekend visited around 35,000 people to distribute and collect tests. We've installed 6 new testing units, we've brought in over 50 new vaccinators and set up 2 new vaccination centres, as well as extending opening hours and capacity at our existing sites. In Bolton, we've quadrupled the rate of vaccination. We carried out 6,200 vaccinations over this weekend, and it's brilliant to see so many people from the most vulnerable groups coming forward to get the protection, whether it's coming forward to get the first jab or coming forward to get their second jab. All in all, this is the biggest surge of resources into any specific local area we've seen during the pandemic so far. It's been coordinated by Dr. Jenny Harries, the Chief Executive of the new UK Health Security Agency, drawing on all the health capabilities locally and nationally that we've built in the last year. I want to thank everyone who's working so hard to make it happen, including everyone at the 2 local authorities, the rapid response team, all the volunteers, including from St John's Ambulance, and most importantly, the people of Bolton and Blackburn for the community spirit they're showing. It's been really heartening, I'm sure the whole House will agree, to see the videos that have been published over the weekend of people queuing up to get the jab. And to anyone who feels hesitant, not just in Bolton or Blackburn, but to anyone who feels hesitant about getting the vaccine right across the country, just look at what's happening in Bolton Hospital, where the majority of people in hospital with coronavirus were eligible for the jab but have chosen not yet to have the jab and have ended up in hospital, some of them in intensive care. Vaccines save lives, Mr. Deputy Speaker. They protect you, they protect your loved ones, and they will help us all get out of this pandemic. Mr. Deputy Speaker, this isn't just about Bolton and Blackburn. There are now 86 local authorities where there are 5 or more confirmed cases. The next biggest case of concern is Bedford, where we are surging testing. And I would urge everybody in Bedford to exercise caution and engage in testing where it is available. Mr. Speaker, Deputy Speaker, I also want to tell the House the latest scientific assessment of this variant. The early evidence suggests that B1617.2 is more transmissible than the previously dominant B1117 variant. We do not yet know to what extent it's more transmissible. And while we also don't have the complete picture on the impact of the vaccine, the early laboratory data from Oxford University corroborates the provisional evidence from Bolton Hospital and the initial observational data from India that vaccines are effective against this variant. This, of course, is reassuring, but the higher transmission poses a real risk. All this supports our overriding strategy, which is gradually and cautiously to replace the restrictions on freedom with the protections from the vaccines. The data suggests that the vaccine has already saved over 12,000 lives and prevented over 33,000 people from being hospitalised. And we're protecting people at a very rapid pace. Last week was the biggest week of vaccinations since the end of March. 36 million people have now had a first dose, and yesterday we reached the milestone of 20 million people having had their second dose across the UK. And I'm delighted to see the figures released by YouGov today, which show that the UK has the highest vaccination enthusiasm in the world, with 90% of people saying that they have had or will have the jab. This was no accident. We began planning the campaign for vaccine uptake a year ago, and I want to thank the huge range of people involved in promoting the benefits of vaccination, from Her Majesty the Queen to Sir Elton John and Harry Redknapp and Sir Lenny Henry, Holly Willoughby and Lydia West, and many, many others. Our campaign has been based on positivity and science, and I'm grateful to everyone, including so many members of this House from all sides, who have played their part. From tomorrow, I can confirm that we will be inviting people aged 37 to come forward before expanding this further later in the week. It's been brilliant to see the enthusiasm people have had when they've been invited to come forward. And we want to make it as easy as possible for people to show that they've had the protection that the vaccine provides. And I'm delighted to say that as of today, people can now demonstrate whether they've had their jab quickly and simply through the NHS app. Mr. Deputy Speaker, since January, we've been following a dosing interval of 12 weeks for second doses. Because the extra protection you get from a second dose, particularly amongst those most likely to end up in hospital or dying, it is incredibly important that everyone comes forward for that second dose at the right moment. The approach we've taken aims to give the most vulnerable the strongest possible protection against the virus. So since January, that's meant getting the first dose to as many people as possible, as quickly as possible. The research shows that this approach has saved around 12,000 lives. Now it's important to accelerate the second doses of all those most vulnerable to ending up in hospital or dying. So our vaccination strategy for all parts of the UK, including the areas of surge vaccination, will stick by the clinical advice set out by the JCVI. First, prioritise anyone over 50 who has not yet been vaccinated. Next, second doses to those over 50 are vital, which will now be done at a schedule of 8 weeks. Then follow the cohorts in priority order and the age groups as we open them. This clinically approved approach is the best way to save the most lives, rather than jumping ahead with first doses for younger people. While the JCVI, of course, keeps this clinical advice under constant review, we are clear that their advice is the best way to protect those most in need of protection and so save as many lives as we can. The NHS will be reiterating this advice to all vaccination centres and all directors of public health, and I'm very, very grateful to everyone in the NHS, in local authorities and in the whole system supporting this vaccination programme for following it. Mr. Deputy Speaker, today's opening and step 3 marks an important step on our road to recovery. We must proceed with caution and care and bear down on the virus in whatever form it attacks us, so that in this race between the vaccine and the virus, it's our humanity, our science and our ingenuity that will prevail, and I commend this statement to the House.